Hi, my name is Linda Tran, and my presentation is on aplastic anemia. So, what is it? Aplastic anemia is defined as pancytopenia with hypocellularity of the bone marrow. So, what this means is that you see a decrease in all cell types that are produced by the bone marrow, which includes white blood cells, red blood cells, and platelets. So the problem is with the stem cell precursor, which eventually differentiates to become one of the three cell types, which is white blood cell, platelet, or red blood cell. And this is why you see pancytopenia because an issue with the stem cell precursor would lead to a decrease in all of those three cell lines. Aplastic anemia can be present at birth, such as in Fanconi anemia, and usually in these cases, there's a physical defect as well. However, congenital aplastic anemia is only 20% of all aplastic anemia. 80% of it is acquired or idiopathic. So it can stem from viruses or drugs and chemicals and radiation, but sometimes it can even stem from pregnancy. So in this case study, we have a 26-year-old nulliparous Asian woman with an uneventful medical history. And nulliparous means that she wasn't pregnant before this, and she was admitted at 14 weeks gestation due to excessive vomiting. Her hemoglobin levels, leukocyte levels, and platelet levels are all decreased compared to the reference range. But 6 months before admittance, her hemoglobin levels were normal. It was 8.1 millimoles per liter, which is in the reference range of 7.5 to 10 millimoles per liter. So no iron, folic acid, or vitamin B12 deficiency was detected. She wasn't taking any medication, and she had no exposure to toxic materials. And at 33 weeks, she developed neutropenia, which is decreased neutrophil levels. So the patient's results show that she has a pancytopenia, and her blood smear confirms that. Now, another way to diagnose aplastic anemia along with the blood smear is to take a bone marrow biopsy and to look for hypocellularity in the bone marrow. They took a bone marrow biopsy from the patient, and as you can see from the left photo, which is the biopsy results for the patients, you see the hypocellularity, so you don't see like a lot of production of different cells. There are a lot of fat cells, which are the white kind of cell, the white blobs. And that's replacing, since there's not a lot of activity, the fat cells are replacing that. And you can see in the image to the right, this is what a normal bone marrow biopsy would look like. There's a lot of activity there, lots of cells being produced and different types of cells, and there's not as much fat cells. The clinical criteria required for the diagnosis of aplastic anemia is a bone marrow with less than 25% of normal cellularity and at least 2 blood cytopenias. In this case, our patient had all 3 types of the blood cytopenias. The patient was diagnosed with aplastic anemia that was acquired from pregnancy. The diagnosis was confirmed by the bone marrow biopsy because there was hypocellularity of the bone marrow, and other causes of cytopenia were ruled out. The treatment of choice for patients younger than 50 years old is allogeneic bone marrow or peripheral stem cell transplantation. They can also be treated with immunosuppressive therapy in combination with blood and platelet transfusions. There's long-term stimulation with hematopoietic growth factors, and also you can treat the symptoms and infections so that the patient can at least feel better. In regards to our pregnant patient, stem cell transplantation was not recommended during her pregnancy because of the teratogenic effects of immunotherapy and radiotherapy on the unborn child. Pregnancy termination to start bone marrow transplantation was not recommended because of the relatively good prognosis for the patient and the baby. Supportive therapy with erythrocyte and platelet transfusions were instead used. They started off with a low frequency of platelet, but increased after persistent thrombocytopenia. And the patient was placed on antibiotics for the various infections that, accompany pancytopenia. Labor was induced, and the patient gave birth to a healthy baby boy. And unfortunately, her symptoms continued after pregnancy. She remained transfusion dependent. She became hypotensive and hypoxic. She was severely vomiting, she had diarrhea and a headache. Um, she needed artificial respiration because of the progressive dyspnea, and she developed pneumonia, followed by a pneumothorax in the left lung, which needed a thoracic drain. She was still undergoing antibiotic treatment, and eventually she had unequal pupil sizes, and it was found that she had a cerebral infarction with bleeding. And because of the combination of the severe aplastic anemia and the cerebral infarction, she had a very poor prognosis, and eventually treatment was just stopped, and the patient died. Aplastic anemia symptoms are related to the three cytopenias. In the case of low red blood cells, that leads to fatigue, trouble breathing, pale skin tone, headaches, rapid heartbeat, and chest pain. The low white blood cells lead to recurring or severe infections, flu-like illnesses, and fevers. And the low platelets lead to abnormal bruising or bleeding. The culmination of these symptoms and the dramatic decrease in all these blood cell counts are pretty much why the disease is so life-threatening. All in all, this case report serves as a reminder that even when a patient has a good prognosis, things can still happen. Now, this case report can be used as a reference for doctors with patients that are undergoing, the same kind of symptoms.